obesity is a really strong risk factor for endometrial cancer. It's actually more closely associated with endometrial cancer than any other cancer. But it's currently not really clear what could be mediating that relationship. So that's what we set out to find out with this research. So many of the potential mediators are metabolic or hormonal traits, which are quite closely linked, which means that conventional observational epidemiological analyses might struggle to tease apart their true associations with the cancer due to confounding. And then additionally, these studies may have reverse causation, where the cancer is causing a change in the levels of a trait rather than the other way around. So that's why we decided to apply a genetic epidemiological technique called Mendelian randomization, or MR. And this basically uses genetic variation to establish causal relationships between two traits. So the advantage of this technique over previous epidemiological techniques is that it uses germline genetic variants to proxy risk factors. And as these genetic variants are randomly assorted at meiosis, there's less bias from confounding. And then also because they're fixed at conception, there's less risk of reverse causation. So we took a systematic approach to identify molecular traits which could be potential mediators, and this involved 2 literature searches. We found 14 potential mediators which had good genetic instruments. And of these, we found that fasting insulin, bioavailable testosterone, and sex hormone binding globulin, or SHBG, were mediating the effect of BMI on endometrial cancer risk. And all 3 of these traits present potential pharmacological targets for cancer prevention in individuals with obesity at high risk of endometrial cancer development, alongside weight management strategies. This is especially promising in the case of fasting insulin, as there are already drugs available for treating type 2 diabetes, like metformin, that are effective at lowering fasting insulin levels and which are known to be safe and inexpensive, which our results suggest could pick away at this link between obesity and endometrial cancer risk.